protocol that we have been taught from our nurse. And I would say the proof is in the pudding, because guess what? Janice has never had a single problem or infection with her port. So I think she trained us the right way.
Everyone, so as you guys can see, I just woke up.
My hair looks a little crazy.
I'm still in my PJs, but first things first, I gotta pump. I got to pump out my breast milk for baby Sushi. Now today is gonna be a fun bittersweet vlog.
You guys ready?
Have you guys seen our recent vlog where I do see my surgeon? I'm getting my port out. And guess what? You guys are seeing it. What? You have numbing cream on, Janice? Why? I am doing my very last access with my port. I am excited. I am ready to get this done and over with. And in a few more days, it's my surgery. And I'm going to take you guys along for this journey of doing it the very last time and the very next journey of me getting it removed. The very beginning, since I have gotten my port, I have been very open about I want it out. I'm ready. Yeah, let's do this. Let's get it out. That was about, my math is bad. 2018, 19, 20, 21, 22. Yeah, I was going to say 5 years ago. So that was about 4 years ago. I've been working hard at that goal and I have finally accomplished it. My doctors did say they wanted me to go about 6 months to a year without really relying on it for me to be able to get it out. And once I said I wanted to get pregnant, they looked at me and were like, you're keeping it in even longer now. So now I did have a baby. It's been over a year now. Like, can I get it out? And they're like, if you think it's for the best, then we're on board. I was like, yeah, let's do this. Now, the good thing is my medical team is amazing. And in the past, I've seen a lot of people struggle getting a port when they knew they needed it. Insurance wouldn't cover it. Doctors wouldn't allow them to get it. Or a big issue is maybe their bodies don't accept a port. I have seen many spoonies who have a port and they've had to change it out multiple times because their bodies just aren't having it. You know, putting a foreign object in your body isn't that easy. And sometimes if your body's already in a weakened state, can be difficult for your body to acclimate to. My biggest worry was when I get it out, will it be difficult to get it back in, or like what hoops, things like that nature. And thankfully, my medical team's like, you did great. You were very responsible with it. You never had any infection and nothing for us to be like, your life's in danger or we need to replace it. So they did tell me that I can definitely get it out. And in the future, if I need it again, if I have a really bad flare, if I go through the same episodes, there's no problems in putting it back in, which seemed easy. All I had to go to, all right, let's put it back in. Let's do it then. Like, it's amazing. Like, I have shown that I'm responsible with it. Right now, I am going to pump, and then we're going to get started on my very last port access. I'm excited. You guys have no idea. This whole morning, I'm like, it's my last time. Now, half of me is annoyed that I have to do it, but then half of me is just like, this is bittersweet. Like, yeah. And 30 minutes later, I got milk. Okay, this is just from one breast, and I was just letting the time go on because the port cream got to kick in.
What is going on, guys? So now I am part of this vlog. Your favorite, I know.
I don't know why.
We have everything set up here for Janice's port. So we'll do, I got fucking flushes. The last time that she will be accessing her port, hopefully for the rest of her life, that she never needs another port. That would be the most ideal situation. Yeah. Don't get me wrong. I guess you can kind of say kind of bittersweet.
Right, I'll say that.
You know, like, it's fun, it's exciting that, you know, this is the last time that she has to do this, but, you know, at the same time, it's always scary thinking about that you're not going to have it anymore in case you need it. Because having a port does come with lots of risks and complications and things that can happen over time. And, you know, it's calculated pros and cons. If the pros outweigh the cons, you do it. If the cons outweigh the pros, you don't need it. Are you ready, babe?
I am. I'm ready to get this done and over with.
So we have all of her stuff here. I have my surgical gloves.
Paul did set this up, and of course he forgot something.
What?
The port kit.
God, no.
Let me go get it.
I literally always forget like one thing, and literally every single time I know what I need, I know what she needs, but in just the haste and doing everything, I always forget one thing. It could be like one of like the little bio patches. I always forget like one thing, and it's really annoying, but this is life. Now Janice is taking off the gloves.
Ready to throw down.
Woo! And then so obviously these are not sterile gloves. The sterile gloves are right there. So obviously the gloves are sterile. That's why you see Janice doing the surgeon walk.
On purpose.
You know, of course. Since the gloves are sterile, she can touch everything on the sterile field itself. Now, you see the needle has like a little plastic tip on it to protect the needle so you don't accidentally stab yourself or other things.
And once it comes off,
once that little plastic piece comes off, it cannot go back on the needle itself. Even though technically you'll say, oh, it's still sterile, this is just the proper sterile protocol that we have been taught from our nurse. And I would say the proof is in the pudding because guess what? Janice has never had a single problem or infection with her port. So I think she trained us the right way.
a lot of people may ask me, like, what's your best advice when it comes down to taking care of port? I'm gonna be honest, and a lot of you don't like my answer. Do your own port care. No one is gonna take care of yourself better than you. Usually whenever someone tells me they got an infection, sepsis, something like that, I ask them, did you do proper protocol? My nurse knows, and she did. I have had many nurses, you know, I had to tell them, no thank you, I can't have you doing my port because this is my body, doing improper sterile protocol.
It sounds bad. The leading cause of hospital-related infections is from improper handling of ports, central lines, because remember, the port is right there in her chest and it goes directly to her heart. Central lines, they can do like in the neck or stuff like that. And again, those go, you know, in the thicker veins to your heart, and those like are very delicate because one wrong move, infection, sepsis, goes downhill very quick. That's one thing that we have learned. Nobody touches this port except for Janice or me. That's it. And nurses get really pissed at us when I tell them, hey, you're doing that wrong.
Yeah.
I don't mean it in a disrespectful way. I just tell them like, hey, you know, the line touched the thing. You gotta disinfect it again. No, it's already been disinfected. It's fine. Yeah, but it touched clothes. It touched your hand, whatever it may be. And they just get pissed. Different ways that people prep their skin depending on the port kit itself. Some of them use this ChloraPrep. We also have some ChloraPrep swab sticks, and then there's other ones that use iodine and then alcohol. So depending on the actual port kit you get, and sometimes what your skin can tolerate, because that's the biggest thing.
I was gonna say my skin's starting to turn a little red. It
Yes.
doesn't really like the ChloraPrep.
Janice's skin does not like the ChloraPrep all that great, but the port kits that we have are all ChloraPrep.
I used to have iodine port kits. Not
Yes.
anymore.
So we have iodine sticks, but we don't have the alcohol sticks. So it used to be iodine, 3 sticks, and then 3 sticks of alcohol. And, you know, those worked great for her, but those port kits they're not very common because most of the time it's just this simple ChloraPrep, one done.
And plus iodine is a little mousy. It stains.
It is. Yes.
So.
You get it on your clothes, that's it. All right, Janice. Now we're gonna let it dry and then stabbing time.
I did do some numbing cream as you guys saw. I do put it on for quite a while. I usually leave it on for like 30 to 55 minutes. I want to make sure I don't feel a thing. Some people, you know, don't use numbing cream. They can handle it like a champ. I give them props. I am a baby. I'm a chicken, whatever you want to call it. I'm not big a fan on needles going into my chest.
Yeah.
So I'll use the cream, whatever makes me feel comfortable, confident, and getting this task done. Now we're waiting for it to dry. You know, just let it air dry on its own, and then, like Paul says, we start the stabbing.
So it's gonna be quick. So we have obviously a couple of flushes. We have lots of extra flushes just in case. Once Janice flushes it, then you have to use a like anticoagulant medication to make sure, because if you just leave the flush in there, you can actually coagulate the end of the line and cause big problems. So you have to use something like heparin. Typically, heparin is actually like a medication that you get prescribed by a doctor for certain things. For this, it's prescribed just for the port. So Janice is about to access, so I do always wear my mask. I do assist her with the flashlight of my phone to make sure that she gets a nice clear picture of her skin and where the needle is going to be going in. And yeah, so let's do this.
So a lot of people or a lot of nurses have told me, oh, just feel for it. That hasn't ever worked for me. So it sounds crazy. Majority of the time when I stab myself, on hopes and prayers. Like, hopefully it gets in. I don't feel.
So, like, you can see the discoloration in the skin a little bit. That is from the numbing cream, and that's exactly what you want. You know that that area is numb. And I can see it from here, and Janice can too a little bit, like the scarring from where all the needles have gone in.
Yeah, that's what I based it off.
Because it's just, imagine, like, every time the needle goes in, out, in and out, it's a lot over the years. It leaves scarring because it's all in the same little area. So,
all right,
let's do this, guys.
I didn't feel a thing.
It's good.
I think this was a good access.
Nice little bio patch.
It went all the way down.
Flushing good?
Yep, it's flushing good. Now let's see if we get blood return. Nope. Okay, so I'm gonna use a couple. We pushed a little bit more fluid. No blood return. Alright. Oh, that feels nice. Look at that flow. And you gotta pump it. Nothing.
So now Janice is pushing the heparin itself. So again, this is a anticoagulant, and the reason for that is just to make sure that at the end of the port line that goes to her heart, that nothing, blood clots, nothing like that form in the line itself. So yes, she does not get blood return, but the surgeon said it's very good that you still can flush through. If you don't get blood return and you can't flush through, big problem.
You got a clot, it's stuck, something.
That's surgery, you have to take it out immediately. So he's like, it can wait till the scheduled surgery date, thankfully, but as long as it flushes through, it's okay. And we do a lot of it just to be on the safe side, since this is the last time she's going to be using it. Use it or lose it. So now it is time to remove the needle itself. So it has like this little butterfly thing. So Janice puts her 2 fingers there on the sides and then just pulls straight on the center. Needle is out.
And you can't go back in?
Yep. So it has a little like lock there so you can't accidentally stab yourself with it. Bio patch is there, take it out. Now here's the thing. Can't blow on it, you can't push air because technically that is open to the port, to the central line. You just gotta wait, don't blow on it, don't do nothing, and just let it heal and close up. And that
Which it should close up in a few
minutes.
moments.
Yeah. It's not like it stays like that for hours, but just a little bit of blood, no big deal. Babe, that's it.
Now I'm just thinking, I'm like, did I forget a step?
Bring myself over.
Do this and finalize it and be done with the end. We're done! I'm so proud.
So Janice and I always help her access the port because 2 is better than 1. We always want to make sure that she doesn't miss a step. Sterile protocol is always done,
Once
like
again,
putting on the
guys,
gloves.
Only let people that you trust touch your port. You may trust your nurse, which we did. Of course, I would trust her to redo this for me if
Well,
she
she's
needed.
the one who taught us.
Yeah, she taught us, but throughout the teaching process, she always practice sterile protocol. Not all nurses do that. So that's something, even when you first time nurse comes in, you want to watch their every step, breathe down their neck. I won't lie, you know, the one that really helped me with all this was my best friend, Sister Jackie. And whenever I had a new nurse come in, she was right there, like ready to go. Like,
No, but Jackie was worse. Jackie would be like watching them like a hawk.
No, I mean, yeah, like Jackie would be like,
Are you doing that right? Up, you fucked
Did you
up.
touch that? Like, she had no shame. It was so funny, but it taught me a lot, and I definitely want to teach you guys that knowledge as well. So definitely learn whatever method works for you, stick with it, and stay consistent.
So one thing that a lot of people don't do, like these are flushes. So these are just saline in here, and all it is just, you know, to flush out the line and, you know, clear it. You know, if you mix this with medication, stuff like that. These are like disposable, basically. Like we literally have boatloads of them, and that's the whole point. This little tip touches anything, so if it just goes like this, boop, this is no longer sterile. You cannot put this on the line. Sometimes it'll like fall on the table and you don't know if it touched the tip. Best practice is just throw it away, go get another one. Some nurses will be like, oh, just alcohol swab it, it's fine.
No, don't
Again,
take the risk. It's your heart, it's your body.
It's a very big risk. The best protocol is just get a nice, brand new, clean, sterile one that you know is zero issues. Again, not for nothing. We have known a lot of people who have ports, a lot of people who are on their third, fourth, fifth port. Seriously. Because they keep getting infections and keep having issues, and because, again, not necessarily them, the nurses and the people who take care of it. Like, that was one thing I was like deathly scared of when Janice was in the hospital with an access port, because those nurses, like the recovery nurses, some of them are great and they listen to you 100%. Like, oh, you want me to do it? I'll do it exactly how you want me to. And others literally go, I've been doing this for 10 years. Don't tell me how to do my job. And again, I get it, but here's the thing. They don't see a lot of ports. They may see one once in a while, or if you're like a cancer patient and you take care of multiple cancer patients, yes, they have ports. But not all nurses deal with ports all the time.
And that's another thing we were told by our nurses and other medical staff. Ask if your nurses are port certified. If they are not, don't let them come near you. Just don't. I've literally had nurses get very angry. Like, don't even talk to us. Like, make our hospital.
Oh no, they walk out of the room pissed.
Like, it's uncomfortable. Like, we're not trying to be mean, but my body, my rules too. No, they don't like it when you stand your ground. And you know, I've had several times tell the charge nurse, yeah, can I switch nurses? After just talking that way and getting your point across, the nurses understand. They're like, we're so sorry.
And usually the charge nurses are more
apologetic about it. Yeah. So those are my best advices for you guys. All right, guys. So in the next few days, it's time to take you guys along for the ride to get my port removed.
God, it feels like just like a year ago that you got your port placed because you were in the hospital. You weren't feeling well.
No, it feels like it was like 10 years ago for me. Like, I'm over this. I want it out. It's never been a secret that I've always wanted my port out. So
yeah, of course.
And now that I'm finally there, I'm so proud. I'm so happy. So guys, this is where we're gonna end it. But the adventure continues. We're not done with this. Don't worry. In a few days, it's time for the surgery. I'm so excited.
Don't get me wrong. Having surgery is not fun, but this one, the outcome, Janice is excited about because there's no longer this worry, you know. And I'm excited for it too because, again, this is always a constant thing you have to be worrying about. Every single time there could be an issue.
Yeah, you don't know if you're gonna get sepsis, if you missed something, you didn't properly do sterile protocol. What if something grazed something that you weren't aware of? That's why I always have Paul here to have another set of eyes. So that's another advice I would give for you guys as well. Guys, I need to take it easy. I need to shower. As you guys can tell, I am gross. I have gel built up in my hair. I am bleeding out of my chest. So it is time for us to clean a little and get back into parent mode. And plus I miss sushi. Because whenever I do my port, it's kind of like an hour thing. Or 2 hour thing, let's be honest. Because then I put on the port cream, I wait an hour, and then I get started. So I'm going to say an hour and a half. So guys, we hope you're enjoying yourselves. Take it easy, rest when you need to, and advocate. Stand up for yourself. Because who is going to protect your body the best other than yourself?
Exactly.
So, guys, this is where we end it, and we can't wait for the next adventure, the next surgery, to get this out. So, guys, for now, adieu and goodbye.